Well, good afternoon. I am joined today by Fire Commissioner Eric Jones, by Deputy Mayor Conrad Mallet, by the President of the Detroit Firefighters Association, Tom Gehart, and the Secretary General of the International Association of Firefighters, who flew in from Boston today to join us, Ed Kelly. And it gives you a sense of how strongly we are going to address this issue, because we have had the issue arise publicly in the last week that is going to be addressed with the utmost urgency and seriousness. The men and women of the Detroit Fire Department are heroes. We depend on them every day to save our lives, and they've done a terrific job. But the people of the city of Detroit are entitled to know that the men and women they are counting on to come save them are free of the influence of alcohol or any other restricted substances. And so what we have decided to do is approach this together. We're not here to focus on who's to blame. We're focusing on how we're going to solve it. But in the last week, I have learned more about alcoholism in firehouses across the country than I knew existed. And I have, I think, a better sense of what is happening in the city of Detroit. So in addition to the 58,000 EMS runs our ambulances make every year, you've got about 25,000 fire runs by the firefighters. And about 3 years ago, the firefighters agreed to double as medical first responders, to get out and respond even faster than the ambulances could get there. And so on top of their 25,000 fire runs, our firefighters have been making 15,000 medical runs a year. And I'm not sure that any of us appreciated that what was already a stressful job became enormously more stressful with the face-to-face personal encounters they're having in dealing with folks with chest pain or stroke and emotional family situations. And so yesterday, as I saw this nationally, I just picked up the phone and I called Ed Kelly, the Secretary General of the International Association of Firefighters. And I said, I really want to talk about this issue nationally. And he's in Boston. And he gave me quite an education, including emphasizing to me that a central piece of this is an employee assistance program. That is, we really should have recognized, both I should have recognized it, the fire and the union leadership, that when we put this extra stress on our firefighters, we should have dramatically ramped up our employee assistance program to help these very courageous individuals deal with the stress, deal with alcoholism, deal with whatever other issues. We should have ramped it up. And I think the fact that we didn't move earlier contributed to this. What made it worse, without a doubt, was the impact of COVID. Because when COVID hit, the leadership of the department put out orders that said we're not visiting each other's firehouses because the health department says we can't spread COVID. And much of our leadership has been operating from Zoom. We had a significant reduction in the leadership of the Detroit Fire Department, dropping in and visiting firehouses, dropping in on fire scenes, the kind of ongoing everyday supervision you would expect. And so we had less active supervision at a time of more pressure. And I do believe that those circumstances have given rise to something that I'm taking as a very serious problem. What I don't know at the moment is the extent of the problem. I've had some people tell me it's limited to a few firehouses. I've seen people anonymously, without any specifics on TV, say it's everywhere. But the truth is that we don't know. And the only way to find out is to run an environmental audit in which people are able to come forward confidentially across the city. I felt that that audit needed to be run by somebody outside of the fire department. And so we have the good fortune to have the former Chief Justice of the Michigan Supreme Court as our deputy mayor. And so Conrad Mallet will be leading that environmental audit. So today, we are taking 4 steps to start to address this. First, we're making it clear that the Detroit firefighters will not be permitted to work under the influence of alcohol or any other restricted substances. Alcohol will not be permitted in the firehouses or on the firehouse parking lots or any other fire department property. That has been a policy. We're making it clear that policy is going to be strictly enforced, and the discipline for violating that policy will be certain. Second, the command staff of the fire department are now returning full-time to on-site work, no more remote work, and there will be far more visitation coming from that leadership into the firehouses, on the fire scenes, to make sure that there is no confusion about our commitment. Third, we are going to partner as a city of Detroit with the Detroit Firefighters Union and the International Association of Firefighters. And we are going to create one of the most robust employee assistance programs in America. We are going to make sure when the men and women of this department are under stress, they have real help available. This isn't something that management should do by itself. This is something that we need to do together, and we are going to do it. And then fourth, Deputy Mayor Mallet will be launching an environmental audit. We're taking these 4 steps today. I've asked the Deputy Mayor to come back in 30 days with a longer-term plan that will include both the EAP program as well as the environmental audit. And I just don't want there to be any question. I take this very seriously. It's not going to be tolerated. On the other hand, I have a responsibility to make sure there's support for these firefighters, and we're going to do that too. Since Eric Jones has been the fire commissioner, the performance of the Detroit Fire Department has improved dramatically. The days of 30-minute or 60-minute ambulance waits are over. Our ambulances are showing up in 8 minutes at the national standard. He's upgraded the quality of the training throughout the department. He's modernized the equipment, improved the firehouses. It has been huge improvement done in partnership with the union. Now we have another significant area of improvement, and that is to make sure that our residents know that the person coming to help them is fully ready to provide that life-saving care. And I am 100% confident that Commissioner Jones will address this problem as effectively as he has all the others. And with that, I'll turn it over to the Fire Commissioner, Eric Jones.
Thank you, Mr. Mayor, and thank you for your continued support. Alcohol or substance abuse is something that will not be tolerated in our firehouses, and our employees must not be under the influence while they are on duty. This is something we take extremely seriously, and I'm profoundly disappointed over the incidents that have occurred in the past week. This is not reflective of the Detroit Fire Department as a whole, but we must address it. Our firefighters and medics are heroes, and they deserve our respect, especially given all the additional challenges and stressors they have faced so professionally during COVID. However, they know they must be subject to more scrutiny about their fitness for duty because the lives of others are in their hands every day. To this end, we are immediately going to resume practices that have been relaxed during COVID for health and safety reasons. All division heads will return to their normal work sites. Prior to COVID, it had been standard for ranking members of the department, including myself, to be on scene at fires and to regularly visit firehouses. Again, for safety reasons, we relaxed that practice. As our city's COVID infection rate declined, we should have resumed that regular interaction process sooner, because that may have contributed to the belief that certain behaviors and activities could be tolerated. I take responsibility for that. So starting today, my leadership team and I are going to become regular fixtures at our firehouses. We will be at fire scenes. Second, we must all recognize the tremendous strain our firefighters and medics have been under for the past year since COVID first entered our borders. Unless you're a first responder, you can't fully appreciate what it's like for these men and women to be first on scene and have to perform life-saving measures during and in this COVID environment. So we are going to support them by significantly expanding our employee assistance program to make sure our brave men and women have access to all the support systems they need to process this added stress in a healthy and productive manner. This is a process that the mayor, deputy mayor, and myself and our union leadership will be deeply engaged in. We're going to take the next 30 days to develop recommendations and report back what we all agreed upon. Turn it back over to you, Mr. Mayor.
So thank you, Commissioner. So when I called Secretary General Kelly yesterday, when the mayor picks up the phone and calls somebody he's never spoken to before, you never know what you're going to get. But as you're going to hear in a minute, I got a very straight-talking union leader. When I said to him, how do you deal with this? Here's what he said to me. He said, this is an issue around the country. The places where the fire department leadership and the unions fought with each other and pointed fingers, the problems dragged out for years. The places where the union and the fire department leadership said, we have a problem, we're going to work together, we solve it quickly and effectively. He says, what's your approach going to be? And I said, I want to partner with the unions. He said, then I'll get on a plane tomorrow and be at your press conference, which is how a man I've never met before is here. And he said to me, you have great union leadership at the Detroit Firefighters Association. I'll be there to support Tom Gehart. I know he's committed to do this, and working together, we'll be able to solve that. And so I've been very impressed with Tom Gehart's approach the last couple of days, and this is going to be something that we can only solve if we're working together. And I believe that we are. And with that, I'll turn it over to President Gehart.
Good afternoon. Following up on the mayor and commissioner's remarks, let me make the following statements. The DFFA categorically rejects the use of drugs or alcohol in the workplace. Simply put, the union supports a zero-tolerance policy. Of course, a zero-tolerance policy cannot operate fairly without a robust and effective employee assistance program. This is particularly so today, when the grim work of the Detroit firefighters and medics has increased dramatically, requiring them to do more with less as the chaotic and frightening COVID-19 virus has spread invisibly throughout our city. While not an excuse, the recent events that we address today only reveal and underscore the terrible emotional cost of our relentless, difficult work. To address this, Detroit Firefighters Association, along with our International Association of Firefighters and the Mayor's Office, we have discussed how we can improve our current employee assistance program. We have discussed how we can improve our current employee assistance program in a dramatic and meaningful way. Our conversations have been productive. Together, we believe that in a joint, renewed commitment to the more muscular and comprehensive employee assistance program is the most effective way to move forward. And we all are committed to making this happen. And at this time, I would like to introduce the General Secretary Treasurer of the International Association of Firefighters Union, Edward Kelly.
Thank you, Tom, and it's an honor to be here in Detroit, in this great city. And I have the distinct honor of serving as the General Secretary and Treasurer of the IAFF, the International Association of Firefighters, representing 325,000 paid professional firefighters and paramedics all throughout the United States and Canada. And what I can tell you is that the challenges that you're facing here in Detroit are not germane to Detroit. The challenges that you have now that you're facing within the fire department are a societal issue. We, as firefighters, are a microcosm of society. And the challenges that we have in our department here as the Detroit Fire Department are magnified because of the job that we do for the people of Detroit. The stresses that we face, the pressure that we're under, takes a toll on our behavioral health. And so often, through codependencies that we see all throughout society, with alcohol abuse, drug abuse. And these challenges, these difficulties, they're not easy solutions. But we owe it to each other to be there for each other. It's our responsibility to be there for the citizens of Detroit. And in order to do that, we have to make sure that we have the resources available to those of us that are suffering. And as firefighters, when one of us has a problem, we don't run away from them, we run to them. And that's the principle of what we do as firefighters for the citizens, and it's what the concept of employee assistance is. It's about being there for each other, getting those that are suffering the help they need, so that not only can they be better family members, better wives, better husbands, better parents, but also better firefighters for the citizens that they swore an oath to protect. And that's why I commend Mayor Duggan and President Gehart and the Detroit Firefighters Union for the leadership that they're showing by stepping up and taking on the challenges head on, so that not only can we have a healthier workforce in the Detroit Fire Department, but so that when we go out the door to fulfill the oath that we took to the citizens of this city, that we're bringing with us the best of us. And what I want to stress today, too, very clearly, is that when you call 911 in this city and you ask for the Detroit Fire Department, you are going to get people in a matter of minutes. They're going to show up and put their lives on the line. And in fact, if it comes to it, trade their life to protect you and your family and your loved ones. And for that, I'm proud to call them my brothers and sisters. And I think you can be very proud to know that the Detroit Fire Department, and its very proud history of serving the citizens of Detroit, will today serve with that same dignity that they always have. And with that, I look forward, representing the International Association of Firefighters, to be a partner in this effort to build a stronger, better fire department for the people of Detroit. Thank you.
So you can see why I have asked for the help of a national leader like Ed Kelly, who knows the best and the worst of employee assistance programs around the country, and he is going to be our partner in designing the best, and to make sure that the entire evaluation is handled with some outside oversight on the environmental audit is Deputy Mayor Conrad Mallet.
Mr. Mayor, thank you to the fire leadership that is here, to Commissioner Jones' leadership team. I want to say to the citizens of Detroit, you can depend on Mayor Duggan and myself to bring the integrity-driven processes that you've come to depend on to this particular opportunity. I want to say to the Detroit firefighters that my father is a former Detroit police officer. My godfather is a former Deputy Chief of Police, Frank Blunt. I've never been a first responder, but clearly I'm aware of the depth of commitment that it takes to do that work, and aware of the toll that it takes on the men and women who perform that service. So we're going to approach this carefully. We're going to approach this in an honorable fashion and do so in a non-confrontational manner. in cooperation with the Commissioner's Office, in cooperation with the union leadership, designed not, as the mayor said, to point fingers, but to figure out solutions to the problems and really, really, really make sure that we have in place recommendations to Commissioner Jones and to Mayor Duggan that they can act on, that have been voiced by and understood by the fine first responders that with whom we'll be speaking. We're going to have first responders. We're going to have members of the human resources professional team associated with the city of Detroit, and civilians like myself as a part of the team of persons, not investigating but talking, not trying to ferret out who is responsible for what, but for trying to give direction to Commissioner Jones and the mayor as to what the frontline men and women in the firefighters in the fire department believe is appropriate in the moment that we are in. We do want to take this matter seriously, and while we're not sure of all the things that we're going to, that we brought up by the persons that we're going to speak, we're going to be doing this in 30 days. We're going to get this done and come back. We are going to give, we hope, an in-depth conversation with our firefighting community, do the audit, take a look at all the firehouses. Commissioner Jones, as the mayor has indicated, has caused there to be, over the course of years, really, really excellent equipment for the firefighters to have available to protect the citizens of the city of Detroit. We'll take a look. It'll be quick, obviously. But this work is important. We're going to take it very seriously in cooperation with the fire department leadership, the union's leadership, and on behalf of our Detroit firefighters, so that we can produce direction that Commissioner Jones and Mayor Duggan can use in a constructive, meaningful way. Thank you, Mr. Mayor.
And with that, we'll take any questions.
This one's for President Gehart. Is there anything, Tom, wrong with the current EAP, and what would you like to see change with this partnership now?
I think today, as we discussed, we're going to start from the ground up, all of us together, and together we're going to put together a program, as the mayor said, that is the best in the country.
So there is an EAP now, though, correct?
There is an EAP that we believe that we can add to and make it more robust, that will be much better for our members, and it will definitely give them a path to go down.
Was there anything that happened in COVID, we're almost at a year now, where a light went off and said we may have a problem here? Or is it just this past week with the 2 incidents?
No, I think, as I stated, this COVID-19 has put a lot of stress on our members. They're worried about getting this COVID at work. They're worried about taking it home. They have kids at home. There were, at the beginning, we had places set up for hotels for our members. That was utilized. It's just, there's a lot going on. You go home, your kids are still home, they're not at school. That adds another stress to it. So there's a lot going on. We had an increase of runs as this happened. So I think between it all, it's starting to hit ahead. And we appreciate the International coming in and the mayor reaching out and putting us together as a team to get this fixed for our members.
Yeah. And Commissioner Jones, when we talk accountability, what does that look like? What can people expect?
It means that supervisors, officers, and when I refer to officers as sergeant and above, that they're going to be accountable. They're going to be accountable for checking the fire station to make sure that there are not any intoxicants on site. They're going to be held accountable for interacting with their members to make sure that they don't notice any signs of impairment. And we're going to continue to interact with our members. The leadership team is going to be more visible. We're taking a hands-on, robust approach to this.
In the 2 incidents this week, what about accountability for them?
Well, that's a disciplinary process that's underway. It's a two-pronged investigation. There's a criminal investigation that's being handled by the Detroit Police Department. There's an internal investigation that's being handled by the Fire Department. We're going to proceed down the line, making sure that those members involved have due process. We're going to work with the union to make sure that we hold the people that were accountable, and we're going to do everything we can to make sure that we don't have repeated instances of these incidents.
Just one more question on this, and then we'll switch to the next panel. Simon Shaquette from Channel 7 wanted to know if there's any concern that firefighters and medics might be reluctant to take advantage of the help that's available to them because they're usually the ones that are offering help as opposed to receiving it.
Ed, you want to take that?
Sure, I can take that. That's a very legitimate concern in general. You know, whether any person that is struggling, the first step toward addressing the problem is admitting that there is one. And that certainly impacts us as firefighters and paramedics. You certainly do not want to admit that you are somehow weak or less than. And that's a challenge. And that's something that when you identify that you need help, that's step one, is admitting that you need help. And as far as to that question about being the help, right? I mean, when people call 911, we come to solve the problem. And admitting that the problem is sometimes within you is certainly an impediment that you have to overcome. And, you know, it's one of those challenges that's part of the puzzle.
All right.
All right, thank you, guys. We are going to switch now to an expansion of COVID vaccinations in the manufacturing centers, and I'm pleased that we're going to be joined by the great Vice President of the UAW, Cindy Estrada. So as she makes her way up here, we'll say thank you to the folks who joined us. All right, we're going to be a little bit brief because the governor is briefing at 2 o'clock, and I promised her that we would be done. But we have, I think, outstanding news for the men and women working the manufacturing centers in the city of Detroit and in the surrounding areas. Today, the city of Detroit is expanding COVID vaccine eligibility to our manufacturing workers. So, any person who works in a manufacturing job, if you live in Detroit or you work in Detroit, you are now eligible to get a vaccine. No age restriction. The Detroit Health Department is going to set up on-site vaccinations at major manufacturing centers in the city of Detroit. And we will be starting at the 2 Jeep plants. Cindy Estrada was my partner from the UAW when we furiously lobbied what was then Fiat Chrysler not to locate that plant in some rural area in another state, but to come to the city of Detroit. This was achieved by UAW city partnership. She's been terrific from the beginning, and we now have approaching 8,000 employees at these 2 locations. And I think all of us were a little bit shaken by what happened at Whole Foods. 23 people positively infected. It shows you the potential when people are working together. The auto companies in the UAW have done a great job so far, but nothing is as good as vaccination. And so we will be providing vaccines to Ascension Health. And if you work at one of the 2 Jeep plants on the east side, you can expect your company will provide on-site vaccinations. If you work at the Jeep plant, please don't call us. We're coming to you. But for any other Detroit manufacturer, if you're a major manufacturer in the city and you want us to come out, call your partner at Detroit at Work, and we potentially will come out to your site as well. For anybody else, if you're not working at the Jeep plant, here's how you get vaccinated. You can call right now. If you live in the city and you work some in the suburbs, you live in the city, you work in Dearborn or Warren or any place, Detroit resident, or no matter where you live, if you come to work in Detroit and you don't have vaccines on site, all you got to do is call the number, 313-230-0505. If you call today, you'll be in tomorrow. Every one of our manufacturing workers who lives and works in the city, you can call now and get your vaccine in a matter of a couple days. When you pull up at TCF, you're going to have to show proof of employment, your pay stub, your company ID, something to show that you truly do work at a manufacturing facility. And so not very long ago, the president of the UAW got a chance to test out the TCF Center. And when I called Rory Gamble to say we're going to do this, he says, I have a vice president who is leading the team over there at what is now called Stellantis. And she would be a great representative of the UAW today. And when she called, she says, can I get a vaccine when I'm there? So to lead off the Jeep plant vaccination, Vice President Cindy Estrada.
Thank you, Mayor Duggan. I want to really thank the mayor as well as the whole city of Detroit for this opportunity for our workers. This just adds another layer of protection for the workers who, throughout this whole pandemic, our UAW workers and, workers in manufacturing, whether they're union or not, have really, been there throughout this whole pandemic working, and it's not been easy. People have watched, we've done a lot of great work along with Stellantis to make sure that our workers are protected, but there's still a risk. And that, as the firefighters said before us, that puts a lot of stress on workers and their families. And we've had some illness in our plants and death. So this is incredibly important. So we just really want to thank the mayor for this opportunity. It's going to allow workers who have kept the economy going through the pandemic, because I know how important manufacturing is, but it's going to give them some peace of mind. So I did ask for the vaccine. I'm going to get that today. Like everyone, when a vaccine comes out, we're worried, but I'm much more worried after seeing people get this illness and the side effects, the importance of, I talked with my doctor, who isn't really big on vaccines, but said, you know what, Cindy, the side effects are much worse than this disease and this virus. So I'm choosing today to get the vaccine, and I hope that all of the workers in the UAW, manufacturing workers who, feel comfortable with it, and will get the vaccine as well at the TCF Center. And I hope that those that don't will do a lot more studying to see how important this vaccine is in consideration to the side effects. So once again, I want to thank the city of Detroit. This is a great, great layer of protection for our workers. So thank you, Mayor Duggan.
Well, thank you, Cindy. And so I think, is Dr. Dunn, will you be administering the shot? So as soon as Denise Fair finishes up, Dr. Dunn, our medical director, you'll be in expert hands, Madam Vice President. But at this point, to catch you up on what we're doing this weekend and across the city, our health director, Denise Fair.
Thank you, Mr. Mayor. I have two important updates to share. First, the health department is committed to being fully transparent. So we are now sharing data on our website that shows the percentage of people who are getting vaccinated at both the TCF Center and the health department outreach, and it's listed by race. This is self-reported data. So if you go to our website right now, you'll notice that of those who have been vaccinated, Black Detroiters account for 82%, with 15% identifying as white and 2.9% identifying as other. Now, this is closely aligned with the Black and brown communities, and this is good news for Detroiters, and this is something that we are definitely proud of. The reason why we are sharing this with you is so that you are clear that our strategies are working and that Detroiters have equitable access to this life-saving vaccine. Also, when you're looking at the dashboard, you will also notice that the race of all people vaccinated by the city, whether they are grocery store workers, first responders, healthcare workers, regardless of residency, 63% are Black, while 31% are white and 6% as other races. So this data is now available right on the Detroit Health Department website, and it will be updated on a daily basis. The next news that I want to share is that Senior Saturdays is expanding once again. We are now up to 6 sites. So this Saturday, we've added 2 new churches. That's New Providence Baptist as well as Greater Emmanuel. So you can make an appointment right now by calling 313-230-0505 for an appointment. Again, this is for Detroit seniors who are 60 years and older. We've created multiple options. So you can go to the TCF Center, or you can go to a local church right in your neighborhood. So in closing, please continue to follow the safety precautions that we already know. And for more information, you can give us a call. We're open Monday through Friday from 8 until 8. 313-864-4000, or visit us on our website. And with that, I'll turn it over to the mayor.
And for the people who are running restaurants in this community, you have good news today. I have been lobbying the governor for some time to raise the restaurant seating capacity from 25 to 50%. And I'm reliably told I'm going to do it in about 8 minutes. I hope she goes through with that. But that's my understanding, and we believe very strongly this is justified. There is no evidence of COVID spread of people sitting down at tables in restaurants. I think we've brought the infection rate down to the point we can open up to 50%. And if we get vaccinated, we can open to 100%. The governor needs to leave the 10 p.m. curfew in place, and will fully support that, because as Denise Fair can tell you, all of the health department enforcement actions have had to do with drinking and dancing late at night. We've had numerous citations that we've had to enforce. We have not had citations for the restaurants. And so I think the governor is taking absolutely the proper step today in opening up to 50%, leaving the curfew in place. And if we can get folks out, get vaccinated before long, we'll be 100% open. There won't be any curfew. But it should be a very good day for Detroit restaurant owners. And with that, John, I'll take any questions.
Okay, just a couple of quick COVID questions, then topic. Christina Hall from the Free Press had been asking if we expect to receive any Johnson & Johnson vaccines.
No. So I do not expect Johnson & Johnson vaccines. Certainly we're not receiving any now. The Moderna and Pfizer vaccines are 95% effective if you get 2 shots. Johnson & Johnson is 1 shot, which is nicer, but it's about 67% effective. Johnson & Johnson makes great sense for people in rural areas where it's going to be hard to get out to them. It makes great sense for people who are waiting 3 or 4 hours in line and aren't going to do it twice, that maybe get 1 shot, because certainly the Johnson & Johnson shot is a step forward. In the city of Detroit, you've got the finest vaccination infrastructure in the country. We can get you in and out quickly through the TCF Center. We can do it twice, and we are going to protect Detroiters with a 95% vaccine. So it is my intention, as long as possible, to stick with the Moderna and Pfizer vaccines and get Detroiters 95% protected. There may be some point weeks down the road where that changes, but because you have the good fortune to live in the city where we have this vaccine infrastructure, you can readily get the 2 shots and be fully protected.
Okay. Mike Wilkinson from Bridge, Michigan says that approximately 32,000 seniors in Detroit have been vaccinated with their first dose, and is still one of the lowest percentages in the state. What could be the reason for the lower percentage, and is that why the city is creating programs for younger people and suburban residents to be able to get vaccinated at the center as well?
Well, yeah. I mean, this is really the point. We've talked about this all along. It's the reason we now have 6 Senior Saturday sites. We went from 2 to 4 to 6. It's the reason we went to the Good Neighbor program for people driving Detroit seniors. We are being very intentional. So I feel like we talk about this every single news conference, but the reality is that in the suburbs, people of higher income tend to be tied into their primary care doctor, tend to be tied into their electronic health record, and they have gotten vaccinations at very high rates. The suburban hospitals in Wayne, Oakland, and Macomb have done a great job of reaching out to their seniors who have got electronic connections. In the city of Detroit, we've got folks who either don't have a doctor, aren't on the internet, if they are on the internet, don't have a personal health record, and it means we have to work twice as hard to reach the same folks. It's why Joe Biden sent us 15,000 vaccines a week directly. It's why we're at 6 sites. It will be more than that on the Saturdays with the seniors. It's why we're going directly into every one of the senior citizen apartment buildings in Detroit, and it's why we did the Good Neighbor program, and we are just going to keep going. There is clearly a racial gap in vaccinations in this state and in this country. And in the city of Detroit, we are pushing back on it very aggressively.
Okay, and last question is on a different topic. Christine Freddy from the Detroit News wants to know if you've got any comment on City Council's approval today of the other 11 demolition contracts that were not approved last week.
All's well that ends well.
All right.
Glad Councilmember Cassidy Lopez came back to work. So
right.
glad she was healthy.
All right. And
I
with
think it
that,
would have been fine last week, but thank you.
all right, thank you. Now it's time for Mrs. Estrada to get her vaccination.
All right. I want to make sure I'm out of the shot here.